If your parent is getting forgetful, don't assume it's ever just aging. One common pill in the house can mimic dementia, and it's often fixable once you spot it. And that's what we're going to talk about today. Hi, I'm Suzanne Fasella, and I'm founder of caregiverhaven.com and the Haven community, where members work with me on their special needs and challenges in senior care. For 25 years, I've been working with seniors and their families to navigate as a physician assistant, both in geriatric care, emergency medicine, and urgent care, as well as family practice. If you like what you hear, please subscribe to the channel and share it with someone else who really needs it. And this tells YouTube to share it with more. If you have ever walked in a room and you have forgotten why you went there, you are not alone. But if it's happening more often, like your mom or your dad are suddenly more confused, they're misplacing things, they don't remember things. There are two medication categories that come up again and again for memory trouble. They're called the anticholinergics and the benzodiazepines. Now, those words sound complicated, but the idea is very simple. Anticholinergics block a brain chemical called acetylcholine. Acetylcholine helps with memory, attention, learning, and cognitive thought. So when you block it, think about slower, foggier, and more forgetful. And that's what people have. It looks like dementia, but it's actually medication side effects. And here's the part that surprises many families. Some of the most common anticholinergics are over the counter. The big one is diphenhydramine, and that's Benadryl. And it's also the ingredient in Tylenol PM, Advil PM, sleep aids, some allergy medicines, and other similar products. People take these every night for years, and they don't realize the brain cost. Let's talk about this for a minute. I want you to think of the traffic in your city, and I want you to think about the pathways that you go to get from your home to your job or to the grocery store every day. What do you use on the road? We use traffic lights and we use stop signs. We have rules of the road. Well, your brain has the same pathways. They have traffic lights. They have stop signs. These are called acetylcholines. Acetylcholines drive the pathway, the thought, the cognitive solution to a problem, okay? So when we take down these traffic lights because of the anticholinergics or because of the Benadryl, and after years and years of working, we're destroying the pathways because the acetylcholines aren't there anymore. And so the pathways don't make sense. So what we're looking at is you trying to get to work in the morning, but all the traffic lights are down. All the stop signs are down, and it's a mess. And the pathways you don't know which way to go. You don't know the detour. Well, the same thing happens in the brain. Now that the traffic lights have been destroyed, your parent cannot think about what is happening next because there is no traffic light in their brain. I'll give you another example. Let's say that you have a song stuck in your head. Okay, and this song keeps going, and you're like, how do I get rid of this song? Some of us have to start a conversation. Some of us have to hear another song. What is going on is that traffic light in your brain that's called acetylcholine is stuck on green. And it is taking that song and it is just keep replaying it over and over and over again. And the traffic light is not changing to red and giving you another thought. That thought is stuck in your brain. That's the pathway that you're not going to get rid of until you do something else. That's how strong acetylcholines are. They are there to put two thoughts together. So when your mother goes from the living room to the kitchen and she forgets why she went there, her acetylcholine broke. She does not have the pathway to remember why she got there. But when you go to the kitchen and you remember why you went there, it's because your acetylcholine, that traffic light, worked. Okay? So years and years of using certain medications destroy the traffic lights, they take down the stop signs, and all of a sudden the person has dementia. Many researchers are finding that this is one of the main causes of dementia. It is not that dementia is on the rise because we are diagnosing it better, but it is on the rise because people are using these drugs that are destroying the traffic lights and the stop signs in our brain. And so therefore, we say one thing and then we repeat it 5 minutes later because we're all mixed up. Okay? Other common anticholinergics or Benadryl, as I said, include certain bladder medications like oxybutynine. And there are some older medications like antidepressants, like amitriptyline. And there's IBS medications like cyclomine, all right? And motion sickness patches can do this. So if you're a caregiver, you've probably seen these names on the kitchen counter. Benzodiazepines are different. They are anxiety or sleep prescriptions like Xanax, Ativan, or Valium. Years of using these can cause dementia-like effects. They calm the nervous system. Another thing you need to know is not only do they affect the memory, the focus, the balance, reaction, but because the damage has been done, we often can't reverse it. And this person just spirals into full-blown dementia. This matters because the falls, the confusion often show up before families connect it to the medication. So here's the key point. Sometimes the problem is called stacking. A sleep aid at night, a bladder pill in the morning, plus another medication for allergies. They all add up fast. And those acetylcholines, out the door, traffic lights are down, everybody's messed up. I'm giving you a PDF called Medication Safety and Savings Checklist. Take it to the pharmacy, spot the risky categories, have them call the doctor or go see the doctor and get these prescriptions off your mom and dad's prescription bottles, or lower the dose. Maybe that will help. So start with the simple medication review. Write down every prescription, every over-the-counter pill, including those PMs and those sleep aids, and every single supplement, because some vitamins, minerals, and supplements cause this too. And then ask direct questions at the pharmacy appointment. Which of these have anticholinergic effects? Are there any linked to memory problems in older adults? What about the benzos? Are those doing these? Do I have those in her plan? And then see if the doctor will taper, because you can't quit them immediately. See if the doctor will taper them off safely, because only they can suggest how to taper them. I can't even suggest for you how to taper them. They have to do that. And then track and know that you are safely providing care for your loved one without destroying their memory down the road. Do it every time they have a new prescription. Tell the doctor you're not going to put them on that prescription until you actually get these medication problems solved. So not only can that occur, you want to look at, are they having thyroid issues, depression, IBS symptoms, poor sleep, hearing loss? Sometimes the dementia look are other things besides dementia. It can be hearing loss. We know there's a 10-fold increase in dementia when you can't hear, and there's a real reasoning behind that. So the earlier you catch this brain fog, the earlier you look at the medications, the earlier you look at why they're not wearing hearing aids and they're not hearing you, the chance that you're going to lower their risk of dementia. Okay? Even look at the allergy pills. Again, don't forget the allergy pills. Those are very common. Take the whole list of everything to the pharmacist, and it'll help you organize their medication list, identify these risks, and you'll walk into the doctor's appointment with clarity and confidence. I saw it over and over again. I was so proud of my patients when they did this. I loved it. Grab that description in the link. So if you found this helpful, please subscribe to the channel, share the video, give it a thumbs up so I can keep producing videos like this. And I'll see you in the next video. Take care, and don't forget those traffic lights. Take care. Bye-bye.